Hello, St. Francis community. My name is Brandi Hudson, and this is your first quarter board brief from the St. Francis Foundation Board of Directors. The purpose of our board brief is to provide ongoing communication about how your philanthropic contributions are invested. I have been a member of the St. Francis Foundation Board for 2 years, and I currently serve as the chair of the Grants Committee, and I am also a member of both the Strategic Planning as well as the Development Committees. This brief will provide insight to and highlight of the Foundation's grant making in 2020. Before I begin, on behalf of the entire St. Francis Foundation Board of Directors, I want to thank you for your support in 2020, which proved to be a year where responsive philanthropic contributions were so critical to our work. Now let's review. In March of 2020, the Foundation, in response to the impact we were seeing in the community, created the Community Crisis Response Fund. The fund is a dedicated, reliable financial resource and support to the hospital and community members, specifically during times of intense difficulty, trouble, or danger. This can include a crisis due to infectious disease, victims of natural disasters or violence, and general support of ongoing critical and emergency care. The fund enables monies to be designated solely to community crisis response and to be a primary mainstay for disaster preparedness. The fund is designated for specific urgent needs as they arise, such as the emergency department, COVID-19 response, the Bothing Burn Center, staffing increases, relief needs, as well as supplies and equipment needed during crisis. The fund provides ability for immediate response. In 2020, through the Community Crisis Response Fund, the St. Francis Foundation supported the St. Francis Memorial Hospital COVID-19 Triage Center Fund of $250,000, which covered supplemental services and supplies not covered by the operating cash flow or parent company common spirit. A staff emergency relief fund of $250,000, which supported extraordinary expenses due to crises such as childcare, food, senior care, etc. Those were all needs-based funding, so they supported those most at risk. Now I would like to speak a bit about the Bothing Burn Center. As many of you know, the Bothing Burn Center is a 16-bed burn center, the largest in Northern California, and it treats over 500 patients annually. Unfortunately, as of the recent past, each subsequent fire season sets unprecedented wildfire records. Therefore, the center is seeing increasing need. Last year alone, there were 9,600 wildfires in California, and the burn center is a critical component of care for impacted patients. I would like to highlight a few ways the foundation partnered. First, the foundation made a grant to the burn center to purchase a device that uses virtual reality technology to mitigate pain. This option provides alternatives to traditional pain treatment options and may reduce the need for opiates. Virtual reality in the burn center is a prime example of how the foundation supports innovation. A grant such as this may prove to address multiple community concerns. Additionally, the board approved a grant to provide clinical psychological support to improve the emotional and mental health of burn patients as well as their families suffering from the trauma of a significant burn injury. And lastly, the board approved a grant to hire and train 8 additional nurses to be able to work in the burn unit in preparation for upcoming fire seasons or unforeseen crises. This evidence-based practice was implemented several years ago and has ensured that the burn center can provide appropriate nursing levels as volume unfortunately increases. Lastly, we recently held a virtual hobnob. I, for one, am ecstatic that we're bringing back our annual gala. We thank those who were able to attend our virtual gala on December 12th. It was an incredible success due to the generosity of donors. We raised over $300,000 and had over 250 households attend. The monies will support 4 areas of the hospital: gender health, the Bothing Burn Center, women's health, and the COVID-19 critical care unit. Thank you never seems enough. However, from myself, the board, and the entire foundation, we are incredibly grateful to each of you for embracing and supporting the mission of the foundation. We anticipate that 2021 may still have a few challenges ahead, and we look forward to continuing to support the city's oldest hospital and the community. Again, I am Brandi Hudson, and this is your first quarter board brief. Until next time, be well and stay healthy.